Hello, my name is Sue Christensen, and I serve as the Substance Abuse Prevention Coordinator for the City of Fitchburg Board of Health. On Monday, August 31st, the City of Fitchburg will observe International Overdose Awareness Day. This is a day to remember those lost to overdose and to offer hope to those still struggling. I know that there are many Fitchburg residents who have lost a friend, a coworker, or a relative to overdose. The disease of addiction does not discriminate. It affects people from all walks of life. We also want to offer hope to anyone struggling with addiction. Treatment is available and recovery is possible. Please reach out. Due to the constrictions of COVID-19, we will be unable to have our outdoor vigil this year. We have put together a short program with the expert assistance of FATV in order to recognize the importance of Overdose Awareness Day. Traditionally, a purple ribbon is worn to show support of overdose awareness. We will have purple ribbons available at City Hall in the parking lot on Friday, August 28th, between 10 a.m. and 2 p.m. We invite all residents to stop by and pick up a ribbon. Narcan and other resources will also be available at that time. As always, masks must be worn and social distancing rules apply. At this time, I would like to introduce Mayor Stephen DiNatale, who will say a few words. Mayor?
Thank you, Susan. Along with the rest of the country, Fitchburg has been affected by the opioid epidemic. Too many of our residents have been lost to this overdose. Addiction affects those of every age, gender, race, and socioeconomic status. In the fall of 2018, I created the position of Substance Abuse Prevention Coordinator within the City of Fitchburg Health Department. Through the Massachusetts Opioid Abuse Prevention Collaborative, the MOAPC grant, we've been able to work with many community partners to implement overdose prevention strategies. Narcan trainings, educational programs, and resource events are held regularly. These important initiatives have increased the awareness of city residents and helped to reduce the stigma associated with addiction. On Monday, August 31st, please join me in wearing a purple ribbon to remember all those who have passed from overdose. I urge residents to stop by City Hall parking lot on Friday, August 28th, between 10 a.m. and 2 p.m. and pick up a purple ribbon. Narcan and other resources will also be available. Remember, you must wear a mask and socially distance. At this time, I'd like to present a mayoral proclamation to Stephen Curry, Director of Public Health for the City of Fitchburg. Whereas the City of Fitchburg does affirm and acknowledge the harm and hardship caused by drug overdose, and whereas we recognize the purpose of International Overdose Awareness Day as remembering loved ones lost to overdose and ending the stigma of drug-related deaths, and whereas we resolve to play our part in reducing the toll of overdose in our community, which has claimed the lives of Fitchburg residents, together with countless more affected forever. And whereas we affirm that the people affected by overdose are our sons and daughters, our mothers and fathers, our brothers and sisters, and deserving of our love, compassion, and support. And whereas we acknowledge the efforts of the City of Fitchburg Health Department and their community partners in promoting overdose prevention programs and working to reduce the stigma of overdose. Therefore, I, Stephen L. DiNatale, Mayor, do hereby proclaim August 31st, 2020 as Overdose Awareness Day in Fitchburg. We encourage all citizens to take cognizance of this event and participate fittingly in its observance. Steve, if you would.
Thank you, Mayor. The City of Fitchburg Health Department is lead and fiscal agent of the Montezut Public Health Network, also known as the MPHN. Members of the MPHN consist of the cities of Fitchburg, Leominster, and Gardner, as well as the towns of Athol, Clinton, Hubbardston, Phillipston, Princeton, Royalston, Sterling, Templeton, Westminster, and Winchendon. The MPHN received a Public Health District Incentive Grant totaling $325,000 in 2011 from the Massachusetts Department of Public Health and was funded through the CDC National Public Health Improvement Initiative. This grant has ended, however, the MPHN continues to sustain itself to this day, utilizing membership and service fees, and has received over $6 million in grants since its inception. Substance addiction is one focus of the MPHN. In 2013, MPHN and the City of Fitchburg were awarded a Massachusetts Opioid Abuse Prevention Collaborative Grant, otherwise known as MOPSI, which is the primary funding for the grant and is the grant issued from the Department of Public Health Bureau of Substance Addiction Services. The grant is designed to create capacity and aims for sustainability within 4 area communities with the goal of preventing opioid abuse and opioid overdoses. To date, we have received over $700,000. The MPHN has installed kiosks in their member communities for the free disposal of unused and unwanted medications. Proper disposal ensures that these medications are not accessible for misuse or abuse. MPHN has also provided kiosks for the free disposal of sharps, needles, and lancets in all of its member communities. Here in Fitchburg, we have installed a sharps kiosk and an unused medication kiosk in the Fitchburg Police Department lobby, which is located at 20 Elm Street in the city. It is open 24 hours. There is also a kiosk for sharps only located at the Community Health Connections at 326 Nichols Road. Sharps disposal is also available at the Fitchburg Westminster Landfill Scale House drop-off located at 101 Fitchburg Road, Route 31, just over the line in Westminster. With the addition of Substance Abuse Prevention Division in the late 2018, the Health Department has streamlined its ability to address the issue of substance abuse, or substance use and abuse in Fitchburg. In addition to the MOPSI grant, we also facilitate a Substance Abuse Prevention Collaborative Grant, known as SAPSI, which focuses on youth and newly awarded Overdose to Action grant, which provides resources to the homeless and publicly housed at risk of overdose. We provide overdose education by promoting Narcan trainings and distribution, panel discussions, health fairs, resource and treatment information, and schools and organizational presentations. These programs increase the knowledge of our city residents to understand the effects of addiction. Reducing the stigma associated with overdose means that more will reach out for help for themselves or a loved one. Addiction affects those of every age, gender, race, and socioeconomic status. On International Overdose Awareness Day, we pause to remember those lost to overdose and give hope to those struggling. We invite you to wear a purple ribbon on August 31st and join us in raising awareness. Before I introduce the next speaker, I would like to thank our substance abuse coordinator, Susan Christian, for her dedication and tireless efforts to reduce substance abuse, not only in our great city, but throughout the MPHN. It is very difficult to put tangible numbers together to show positive results of all her efforts. However, I and many others in the city feel she has done an incredible job and has made a difference. Much of our prevention work relies on collaboration and cooperation with many community partners. District Attorney Joe Early and his outreach staff have supported every event we've held and have been essential in providing school-based prevention curriculum. In early 2014, D.A. Early attended a MOPSI meeting here in Fitchburg that brought together law enforcement and medical personnel to discuss training police officers to administer Narcan. As a result of that meeting, 3 MOPSI community police departments, including the Fitchburg Police Department, signed on immediately. Numerous lives have been saved due to this initiative. D.A. Early now implements an active opioid task force active through the county. He has consistently led the way in the North Central Massachusetts prevention efforts, and it is my pleasure to welcome him today.
Hi, I'm Worcester County District Attorney Joe Early Jr., and I'm honored to speak to you today as we observe International Overdose Awareness Day. I want to thank Mayor Steve DiNatale and Police Chief Ernie Martineau for their leadership in helping reduce overdose deaths. Chief Martineau did an amazing job earlier this year getting other Worcester County departments to join the program that we launched this spring called SIMS to track and respond to overdoses. With regards to stigma, we have a sign at the front of our office that reads, Mother, Father, Brother, Sister, Niece, and Nephew. As you all know, that these are the true victims of this terrible disease. The true victims aren't junkies, addicts, losers, or other disparaging names. They're not even numbers on a grim spreadsheet. They're human beings with families and friends that love them and that are devastated by their loss. I share your grief. You have my condolences. We've had this in my family. We've had this in everyone's family. And everyone needs to remember that those who have died are our sons, daughters, brothers, sisters, parents, and best friends. Remember, every daughter is a mother's daughter. Every young woman is a father's baby girl. And they didn't choose addiction. Addiction chose them. Just like some are afflicted with cancer or heart disease, and others are not. This is a very complex disease of the brain. And those who died didn't set out to ruin their lives and bring heartache to their families, but they caught up in something so powerful and evil that they just couldn't escape. We need to end this pain. We need to do what we must to erase the stigma of drug addiction. Addiction is not a moral failing. It's not a moral leprosy, but a very chronic and very complex disease of the brain. Since 2001, groups around the world have been observing International Overdose Awareness Day to remember those who have lost their lives to addiction. This year is different because we're dealing with a global pandemic. But COVID-19 has only diverted attention from substance use disorder. It hasn't stopped the somber drumbeat of lives lost and families shattered by addiction. It's just made it more difficult for heartbroken loved ones to grieve. COVID-19 also hasn't halted the stalwart efforts of so many great people to end addiction either. It has just temporarily changed the way we do business. Our office, our community partners around Worcester County, and our local police departments are working every day to erase the stigma of addiction and to save lives. Fitchburg has done a terrific job in fighting the problem, and I want to thank everyone involved. I also want everyone to remember what this day is about. We are observing International Overdose Awareness Day remotely this year so that we can stay safe and healthy, but it is still so important that we take time to remember those who have lost their lives to addiction. You're not alone as you deal with your grief. Thank you.
Hello, my name is Michael Kushmarek. I'm president of the Fitchburg City Council. It is important that we stop to observe and recognize Overdose Awareness Day, to remember those that we've lost to an overdose, to mourn with families scarred by this illness, and to support those who still struggle. There is still hope. Nearly 1 in 3 homes are mired in a battle with substance abuse. My home was no different. I grew up in a family that struggled with it, and I've lost family and friends to addiction. But I'm not alone in that experience, and neither are you. This experience and this struggle can define you, but it doesn't have to. You're not alone going through this. We cannot let this widespread prevalence of overdose and addiction be ignored or be relegated to shadows of our society. We need to destigmatize addiction and substance abuse. We need to acknowledge it, talk about it, treat it, heal from it, and work in collaboration with our city's substance abuse prevention programs to ensure that we break this cycle. When we come together as a community, we heal as a community. Remember, there is always hope. Thank you.
As we reflect on the meaning of International Overdose Awareness Day, I would like to share some of the efforts of the Fitchburg Police Department in addressing the issues of addiction. We have collaborated on several programs with the Health Department over the past year. Prescription Drug Take-Back Day is held twice a year and allows our residents to properly dispose of unused and unwanted medications. The Worcester County District Attorney's Office, the Fitchburg Police Department, and our Health Department also held informational programs at the Senior Center focusing on the importance of proper storage and disposal of prescription medications. The Community Engagement Unit supports and attends meetings and events the Health Department holds throughout the city on the topic of addiction. Earlier this year, the Fitchburg Police Department spearheaded an effort in Worcester County with a tracking system that allows law enforcement to track overdoses in real time and then connect overdose victims with recovery care treatment options. This new approach recognizes the importance of reaching out to overdose survivors and their families and offering support. I want to reinforce the importance of the Good Samaritan Act. The legislation protects victims and those who call 911 for help from charges and prosecution. This law does not apply to those with outstanding warrants, probation, parole, or intent to distribute traffic charges. If you witness an overdose, please call 911. You can save a life. I hope you will wear a purple ribbon on August 31st as we remember those who have passed from overdose and give hope to those that are still struggling with addiction. Thank you.
Thank you, Chief Martineau. Today I'm joined by Emily McRae. Emily is the Executive Director of the North Central Mass Faith-Based Community Coalition, based here in Fitchburg. Welcome, Emily.
Thank you. It's such a pleasure to be here. I want to tell everybody a little bit about what we do, if you don't mind.
Absolutely.
Yes, I'm the Executive Director. I've been with the agency for 10 years. That's our entire 10 years of existence. We are a coalition of 11 churches, and we, in this particular project, which we call Breakfast at the Y, we serve people a meal. We started off on Sundays because our whole mission was to serve people in ways that weren't being served before, the niches. So we found out that no one was serving on Sundays. So we started serving this Sunday breakfast, and we had a small group of people, and we served about 30 people. It cost us, well, we were making about 200 meals a month. And the people who came to see us were either elderly, homeless, elderly and homeless. A lot of them were disabled, and many of them had addiction problems. Mm-hmm. Quite a few that had addiction problems as well. But they came from all different walks of life, and some of them were nurses or doctors before, and something happened in their lives and that changed, and it changed their fortunes. So that's how we were, that's how we ambled along until March, and then for a lot of people, things changed dramatically, and COVID entered our lives. And I saw in the paper that the Y was closed, and that's where we're hosted. The Y hosts our meal. That's why we call it Sunday Breakfast at the Y. And I said, oh no, I'm going to be serving meals out of my car window. I'm going to be driving around passing out sandwiches because the Y is closed. And we were really blessed because the Y said that they would open for us. They would open the kitchen. But like everyone else, we had to change things, so we started serving to-go meals. And we had people standing 6 feet apart and wearing masks. And another thing that changed is that we had a surge. You remember that? Mm-hmm. And they said that certain people were vulnerable. And I would be in that category, considering that I'm well over 30 and I have a heart condition. And the Y said I could no longer serve in that position. I couldn't be there at the Y. And being the executive director, it's hard not to have anybody supervising. We were blessed at that particular moment by Newview, who gave us the services of 3 individuals who all served in management positions. So they took over that middle management position and just ran the program and made all the changes that need to be made. One of the changes that we couldn't control was the fact that serving 200 meals a month costs a lot more money than serving 1,000 meals a month, which is how fast we grew. And lo and behold, Susan called me, and I was so excited to hear from you. So can you tell me, tell us a little bit about what you did?
Absolutely.
At that point?
Recently, the city of Fitchburg was awarded a grant from the Department of Public Health through the CDC. This grant is called Overdose to Action. And the purpose of the grant is to reach out and provide overdose education and overdose prevention to people who are homeless, at risk of homelessness, or publicly housed. And we want to be very clear that this doesn't mean that DPH thinks that anyone who is homeless automatically has a substance abuse issue, nor does anyone with a substance abuse issue necessarily have to be homeless. This is a specific purpose of this grant, is to service this community, a community that often falls through the cracks. As we know, if certain needs aren't being met, then it's difficult to navigate your way through life itself, let alone try to get treatment. So one of the ways that we could implement this grant during the time of COVID was to provide financial support to your program, along with resource materials that you have been graciously handing out to those in need, so that they are able to access resources when they're ready.
Right.
So can you tell us a little bit about how this works practically?
That was the most dramatic change that happened to our program, was working with you, because, well, working with you and the gift that we got from NewView for having these new workers. But one of the workers became our outreach worker, our outreach specialist, and he was going out into the fields. He was going into under bridges and going out to homes and neighborhoods that he knew had people that had needs. And that's how our numbers grew from serving 30 people to serving 80 people. And some of the people he met had substance abuse issues. What we could do, what we could provide, was something that no other service that I've heard of in our area is doing, is that we had and set up relationships with people because we fed them twice a week. When you feed people twice a week, you get a lot of credibility. And people started to trust our workers, and they were willing to take that next step and go into rehabilitation. And so far, since March, 17 people have gone into rehab from our program. But we're so grateful for the Narcan that we get from Keith, who you'll meet later on, and from the program that you have that helps us to give people information about substance abuse and how to turn their lives around. And I was so touched by what the attorney had to say when he was here about the fact that this is a family problem, because one of our workers, the outreach worker, received a testimonial. And the testimonial was so touching because it came from 4 people, not just one. It came from this young man and his cousin who went into rehab with him, and his mother, and another family member. 4 family members got together and wrote these testimonials to say how grateful they were that this life was saved. So when you save that life, you save the whole family. And that's what's happening with our program. We're a small program. Well, we were a small program. We offered food and we offered comfort. But now we can offer something more because of your contribution, and we are so grateful for it. And there are many people. I wish, sometimes it bothers me that I can't take the people that give us this assistance. I can't take you down to see the people and see what happens when they receive the gift that you've given them, because you're giving the gift of life. And there's no way, no conceivable way to tell you how much that means and how much it means to the people that we see.
You are certainly doing work that is needed in this area. Having been in a position before where I did that outreach and helped people get into treatment, I recognize the effects it has on not only the immediate family, but the extended family and the community itself.
Right.
You're helping someone turn their life around and hopefully come back into the community, often reach out to others who are struggling, and also become a member of the community and participate. And that's really important.
Right, and like the attorney said also, is that the people that we're reaching out to and the people that are involved in our program, they're not people that people think of as being drug addicts, whatever a drug addict is supposed to look at. One of the people we helped to serve was a nurse. She'd come up here from Maryland. She's in a strange place, and she had this addiction, and there's nobody else to reach out to her. And they supplied the nurse with Narcan and took her to rehab, and now she's fully functioning and she can do her job now. The people that we reach, some of them some of the people we reach take one look at us and what we do and cry. I mean, there's no other way to express what goes on, but they just completely break down and cry because they think nobody cares about them. And that's one of the biggest things that you do by the work that you're doing, is that you're telling somebody that thinks that they're the lowest piece of nothing on the ground, that somebody cares about them and that they're worth something. And I can't think of a better gift to give someone than to give them a feeling of self-worth.
Absolutely. And providing them not only with food to nourish themselves,
Right.
but the friendship that you offer as well, which is
Right.
very important, and,
Right.
and helps to get people into a place where they're ready to ask for help.
Right.
Because oftentimes when you don't know where your next meal's coming from, people are unable to make that next step.
Right.
So we're really excited about your program,
Thank you.
we thank you for what you do, especially in this age of COVID, where there aren't a lot of resources like that in person. And
Right.
I'm excited for this to end so that I can get in the trenches with you.
Thank
But this
you.
was a very good use of the grant money that we received from the state. They were excited for this program as well. So
Wonderful.
we thank you for your work. And
Thank
thank you for
you.
joining me today, Emily.
Thank you so much.
Today, millions of people all across America are building a life in recovery from mental and substance use disorders, helping themselves and helping each other with friends, family, and community, lending their strength and support. Join the Voices for Recovery. Together, we are stronger. For 24-hour free and confidential information and treatment referral for mental and substance use disorders, for you or someone you know, call 1-800-662-HELP.
Welcome back. Today I have someone with me who I think everyone around Fitchburg has probably seen at one point or another, Mr. Keith Barnaby from AIDS Project Worcester. He is a harm reduction educator in the area. Keith has been instrumental in instituting Narcan trainings on a monthly basis that we sponsor, as well as throughout Fitchburg at various times. And if there's an event happening, Keith is there with his Narcan. So welcome, Keith.
Thank you, Susan. Thank you for having me here. It's a pleasure to be here. My name is Keith Barnaby. I work for AIDS Project Worcester. I'm a harm reduction specialist. So basically what I've been doing for the last couple of years, I started back in December of 2018, and we do Narcan trainings through a program through DPH called OEND, which stands for Overdose Education, Narcan Distribution. And we basically go to just about anywhere we can go. Obviously, the key places to go is going to be your sober homes, your halfway houses, MAT programs, medicated assisted treatment, your methadones. But we're always looking for ways to try to reach those populations that we can't get to. Trying to find those vulnerable populations, and part of that is outreach and doing the street outreach. And we've been doing that for a couple of years now. And thanks for that, with the help of the City of Fitchburg and more specifically Sue. She's been instrumental since I've started here back in 2018, and getting a lot of these trainings out there and in the events and all that stuff. And now with this grant, it's going to really help us, hopefully push us to the next level with our outreach efforts.
The grant that Keith refers to is the Overdose to Action grant, which we just discussed with Emily. And through that grant, we have been able to supply AIDS Project Worcester, and specifically Keith and his outreach program, with supplies that he can distribute to the homeless, along with resources for addiction services. So why don't you tell us a little bit about those supplies and how it's going to work?
Sure. And street outreach, really, it's such an instrumental way to reach folks out there. Like I said, we're always looking for those populations, the gaps. Where are we missing folks? And street outreach is just a tremendous way to really reach those vulnerable populations. We call it touches. Every time you have a touch, there's an opportunity, and every time there's an opportunity, there's a chance for recovery. And that's why it really works with the outreach. So some of the stuff that we supply on a daily basis out here through AIDS Project Worcester and now through Fitchburg would be blankets, would be sleeping bags, snacks and drinks, socks. Socks is my #1 item out there in the streets. It's very, very important. Snacks and drinks, hygiene kits, backpacks, first aid kits, you name it. We'll get it out there on the streets. And a lot of stuff is just basic life stuff to the everyday person, but out there on the streets, it really means a lot to folks just to sometimes just get a pair of socks. And it establish that relationship with the folks out there too. And that's where the whole process kind of starts, and you earn their trust a little bit. And you hope for that one day, on the right day, you catch that right person and they're ready for help, and you can refer them or get them to services or treatment, you know, and being pretty connected in this area, you know, if somebody's looking for help or treatment, I can usually send them on the right way and give them a nice warm handoff there as well, so.
I think the relationship building part of it is the most important, as Emily discussed too, for people to know that there's someone that cares about them, that they see on a regular basis, that's offering them food, basic life necessities. Because until if you're not eating or you have nowhere to stay, it's really difficult to make that decision to go into detox.
Absolutely.
Your basic needs have to be met.
Air, food, shelter, and water, you know?
Absolutely.
And that's where it kind of starts, and certainly the Narcan plays a piece in that. Really, this is 2020, and where we're at today, if anybody you know is in some kind of a substance use disorder, or you're just new to this, start with Narcan. It's the first thing you need to have. Everybody needs to have Narcan, because Narcan saves lives. The last thing we want to do is lose somebody to an overdose. I truly believe everybody can recover in their life, no matter where they're at, really. And I've seen some miracles, a lot of miracles happen over the last 6 years or so doing this kind of work. But there's an opportunity there, and everybody can recover. But if we lose them to an overdose, there is going to be a 0% chance of recovery. So it's like, my goal out here really is it's Narcan and Narcan, Narcan. I'm trying to keep people alive. If I can keep you alive, we have a chance. And if we got a chance, the recovery might be possible. So I'm very, very pleased to be working side by side with City of Fitchburg with this, and to have these funds to really kind of push us to the next level with our outreach efforts, so we can really try to touch as many people as we can out here and try to save lives. At the end of the day, it's keeping people alive.
Absolutely. I think
We
that's
gotta
the
keep
goal.
them alive.
That's our goal together with
Yeah.
our other community partners as well. And I know that I've been told of several overdoses that have been reversed by people who had Narcan that they received after going to one of your trainings, learning how to use it. A little later in the program, Keith will be doing a Narcan training, and we invite everyone to stay tuned to watch that. It's not a long training, but you'll understand what to do. And on August 28th, when we hand out the purple ribbons, we'll also have some Narcan available as well if anyone is in need of that. Do you have a general story you could share with us about someone that maybe you trained and what the result of that was?
It's funny when you said that, just mentioned it, you know, someone had gone to a training and then they used an Narcan. This has happened to me more than probably a half a dozen times at this point. One I can take in particular was last summer. I did a training out, and it was actually in City Gardner. It was a big training I did out that way, and I had met a lady out there, and she had two brothers who were both struggling. And I talked to her. She stayed afterwards and talked to me for a little while, and I gave her a bunch of Narcan because I wanted to make sure she had plenty. And I actually got a phone call that night. It was about 3 hours after I got home, because I told everybody, if you use the Narcan, if you can call me and let me know so I can just record some data. And she called me, and she ended up saving one of her brother's lives with the Narcan. It took 4 Narcans before they even got 911 got there. And he's still with us today. And he's in recovery because I see him all the time now. He's got a job. He's back in the community. You know, he's really doing well. But it's like, I never know those moments. Like, I meet so many people out here. I hand so much Narcan out, and I really just don't know if I put that Narcan in somebody's hands. Like, is it going to be used? Like, is somebody going to use this Narcan? And that has happened to me, you know, at least a half a dozen times now.
That's wonderful.
That we know about, really.
Yeah, absolutely.
There's a lot of times we don't
about.
know that it's happening. Yeah.
And the goal of getting Narcan in as many hands as possible, so that when that overdose occurs, there is someone there that can react. You don't have to be a first aid trained person. You don't need to be an EMT. It's easy. It's nasal spray.
Yeah.
And if you can keep that person alive until 911 arrives, I know in the training, number one, call 911.
Yeah.
If you get them on the way, because oftentimes that'll make the big difference.
Yeah. These deaths are preventable, 100% preventable, but there needs to be somebody there that knows what to do, and that's with or without Narcan. And that's what my training was kind of teach people too. Like, what if I don't have Narcan? What am I going to do? And how to assess that person quickly, and of course the 911. So I kind of just put all that into a little short presentation, and again, try to help these families and friends and everybody out there that's surrounded by this. And if that does happen to you, you're going to be prepared and be ready, because it's a very, very traumatic experience to go through an overdose, to see an overdose happening. It's frightening, it's horrific, and I need people to take a deep breath and react instead of panicking and so we can give this person a chance, and we don't want to lose them today. You know, give them a chance.
Absolutely. Another tip that we'd like to share is I've recently heard from some members of the fire department that oftentimes they'll receive a call to go to an overdose. It may be in an apartment building, and the person doesn't want to stay there, so they just call and say, come to this address, there's been an overdose. The fire department gets there, and there's 15 apartments, all with the door shut. So if you do call, leave the door open. If you don't want to stay, leave the door open. Drag the person out in the hallway. At least cut down that barrier for time, because that's the important thing, is the time. How long is that person out? That makes a big difference. If you do call, the Good Samaritan Act protects you as well as the victim from prosecution. It won't protect you if you have outstanding warrants, if you're sitting on the amount of drugs that would require a distribution charge.
Yeah.
But if you're just with somebody, they overdose, call 911. They don't want to arrest you. They want to get people help.
That's right. And really, you are protected in that Samaritan law. And I also say, when you call 911, be specific. Give them the exact location. Do not make them search, because every second counts at this point. So if I'm third floor, second, back door, like, give them as many details as you can. Again, these are just like little things we try to, just little tips out there, because again, every second counts, and being specific with that. And if you do have the warrants, and I don't care about people's warrants, but if you do have that warrant, call 911. Be specific, and then you can get out of there and give this person a chance. If you have Narcan, maybe you can Narcan them real quick and then get out of there.
Yeah.
Again, I don't want to see anybody get jammed up, but I want to see people at least have a chance, to save their life as we can.
Absolutely, because every minute does count when someone's down. By the time fire, police, or EMS get there, if they have to start searching through apartments to find someone, it could be a few minutes, and that does waste a lot of time. Well, thank you, Keith, for joining us, and we look forward to any word on when the live Narcan trainings will resume.
Will do. Thank you for having me, and again, thank you. What a great partnership this has been since I've come on for almost 2 years at this point. Since day one, we've kind of collaborated together and been able to do a lot of good things in the city of Fitchburg, and I look forward to continuing to do that with you. So thank you very much.
Thank you.
I can do this.
We believe in you.
Each day brings hope.
Every day, millions of people celebrate their recovery from addiction and mental illness while others begin their journey. Be a part of it. Tell your story. Join the Voices for Recovery. Together, we are stronger. For 24-hour free and confidential information and treatment referral for mental or substance use disorders for you or someone you know, call 1-800-662-HELP.
I want to thank everyone for joining us for this short program. We really want to recognize Overdose Awareness Day here in Fitchburg. And at this time, I'd like to turn the program over to Health Director Stephen Curry.
Thank you, Sue. I would like to remind folks of our Purple Ribbon giveaway. That will be August 28th from 10 to 2. And it will be in the parking lot outside of municipal offices located at 166 Boulder Drive. It's from 10 to 2, as I mentioned. And we encourage and strongly encourage folks to make sure that they're bringing their masks, and we will make sure that social distancing and the whole program is safe to attend.
Absolutely. We will have some Narcan available at that time, as well as any resource information that people are looking for. So we invite you to come down, wear your ribbon on August 31st as we promote Overdose Awareness Day. Thank you.
Thank you.